Pfizer is working on a new weapon against COVID-19. The drug company announcing its experimental pill, which can be taken at home, is highly effective in treating COVID. It will ask the FDA to approve the treatment as soon as possible. Joining us now to talk about this weekend's new development and others is Dr. Anthony Harris. Welcome back.
Thank you so much, Rutabaga. Great to be here.
So great to also get good news, right? What seems to be a magic pill, at least on its face. Let's start with the Pfizer pill. It says it's 89% effective in high-risk cases. What does that mean?
Sure. So 89% effective in high-risk cases means that if you take this pill within 5 days, which was in the study of getting symptoms, then you have a very low risk of being hospitalized and almost a virtual zero risk of dying from COVID-19, which is a huge game changer when we're talking about treating individuals for COVID-19 infections. And so we had early hope with Merck. Now this is even greater hope with Pfizer.
And let's talk about Merck, too. Britain becoming the first country in the world to approve any kind of COVID-19 pill. It's slightly different, right?
It is slightly different. And the fundamentals of it is that the Pfizer vaccine uses some classic medicine, so to speak, right? It's called a protease inhibitor. It's the same type of approach we've taken with HIV treatment, where it's high intensity treatment for preventing the virus from replicating. As opposed to Merck, Merck also prevents the virus from replicating, but it uses some new approaches that disrupts the DNA of the virus. And so those are the main differences, but there is a difference also in the number of people in terms of percentage of who was effective for. And we know that Pfizer is more effective than the Merck at this point in time.
And now that we have a vaccine and we have a potentially effective treatment in the pill form, does that mean this is the end of the pandemic and kids are also beginning to get vaccinated?
I wish that was the case, but unfortunately, no, right? These pills, both the Merck and the Pfizer treatments, are intended for the at-risk population. And those are the individuals with pre-existing conditions that make you at risk for poor outcomes, obesity, heart disease, diabetes. And so if you are in those categories, this may be, again, the game changer for you, but unfortunately not the panacea for everyone else. Just the risk-benefit profile may not be there. But wait, there's more. We know that both Pfizer and Merck are doing studies and looking at utilization of these medications in the general population, even prevention of exposure in the home. So we may see more positive news, positive studies coming from both organizations.
We all hope so. And I want to shift gears now and talk about a different vaccine, a new study out of the UK again showing vaccination for girls against HPV reduces cervical cancer rates by 87% in women. And it also shows that those who are vaccinated at the earliest ages were the most protected. So what is your advice to parents regarding a vaccine? And again, with this vaccine as well, a lot of hesitancy on the part of parents.
You know, there has been hesitancy, but this data is just telling, right? In terms of the power of vaccination, if nothing else, we know that this vaccine in the UK has done a tremendous job of almost eradicating cervical cancer. Young women 12 to 14 were administered. Up to 90% of parents in the UK took their daughters to be vaccinated. And so we know that this vaccine can prevent these cancers. And that's just a game changer again in terms of how we address public health. And, you know, when we have these solutions in the marketplace, they're available, they're safe, and they're effective. It's really hard to argue against not vaccinating your children. So be at ease, low side effects, and let's do it to eradicate cervical cancer here in the U.S.
All right, Dr. Harris, thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.